Okay, good afternoon, everybody. If we could have everybody's attention to keep the background noise down. We're going to begin our press briefing. Let's see. Can you guys hear that background noise probably? Okay. Okay, good afternoon. My name is Peter Zanoni. I'm Corpus Christi City Manager. We're going to begin our joint Nueces County and City of Corpus Christi COVID-19 press briefing. We have these press briefings Monday through Friday at 5 o'clock, and we report on information for the community on how to stay safe and be aware of what's happening in our community when it comes to COVID-19. We share statistics that show what has transpired in the past 24 hours with respect to new cases, who has been hospitalized, or numbers of persons hospitalized, and numbers of persons that are recovered or recovering. And so today, since it's Tuesday, we have our two elected officials, Nueces County Judge Barbara Canales, who will be here, and Mayor Joe McComb, Mayor of Corpus Christi. They're here and speak generally on Tuesdays and Thursdays, but some days they'll attend and speak at some of the other briefings if there's a reason, or if the subject matter warrants they're spending time to come here. So we want to thank the community for watching. I know personally when I step away from the mic, I check out Facebook, and we know a lot of people watch this via Facebook. We're also on YouTube, and then we're grateful for the networks that cover this and stream it live to some extent, or have it in their local news shows later in the afternoon. We also know the Caller Times is here, and we appreciate that. We appreciate the public watching. This is a great way to keep informed and help you stay informed, but also have you help spread this important information to your family members, your neighbors, persons you go to church with, and so on. So that's a shout out that we want to give to the community. We think that Corpus Christi has been doing a great job in managing COVID-19, in part because people are listening and adhering to some of the things that we're telling you and the medical community is telling us. Okay, so with that, today I'm going to do just a few comments on statistics, and then I'm going to turn it over to Annette Rodriguez, our Director of Public Health, who will talk about today's drive-through collection site and other tests that are taking place in the region. Nueces County Judge Barbara Canales is here today. She'll be talking to us about the STX Beef plant, where the state and the city county have done extensive testing, and she'll have some prepared remarks to inform you about on that situation. She'll also talk to you a little bit about the CARES Funding Act and how that'll impact the county and the city. And then Joe McComb will close out the meeting. We let him speak towards the end, but we know he could speak first or second and third. He'll do great at any spot speaking, but we'll let him come up at the end. And he'll talk also about some of the statistics and talk to us about some of the funding we're applying for specifically from the city, and then also talk maybe a little bit about the disaster relief fund that he's been managing. Okay, so with that, let's begin with the statistics. We have a couple of graphs to show you as well. Since 4 o'clock yesterday, we've looked at the numbers to see what's happened in the past 24 hours. In the past 24 hours, we've picked up an additional 27 cases. So yesterday, I was saying yesterday's 15 was the highest in our tracking record to date, but today that replaces that obviously with 27 additional positive cases, and the majority of these are from the STX Beef processing plant, and Judge Canales will have more detail on it. She's been taking the lead role in working with the state and working with the operators at STX. So we'll have her elaborate on that, but suffice it to say, 27 is a trending up number, as well as the 15. Both the 15 and the 27 are from two institutions. The STX Beef today, yesterday was from the transitional home that we were testing patients from, or persons from as well, yesterday. Okay, so with the 27 new cases, our total to date since we've been tracking is 174. The number of persons that have recovered is 80 have recovered, so that leaves 91 active, and I'll go over that again, but just of the 174, 91 of those are still active. The rest have recovered. We report out to the community deaths, any change in the death situation. So we've been at a pretty steady, 3 persons have died from COVID-19 in Nueces County. That number is holding pretty steady for the past couple of weeks at least. 2 are from the city of Corpus Christi and 1 is from Robstown. Our male-female distribution, we track the number of persons that have COVID-19 by male-female. And the last couple of days, what was an even balance between male and female has shifted a little bit to where there's more males now that have COVID or have had it than female. So 99 males and 75 females is the running total. We look at the age distribution to help the community realize that it doesn't matter how old you are, anybody can get COVID-19. There was some old thought back in the day where young persons couldn't get it, but in fact, in our age group of 20 to 29, that has about a higher age group, a higher number of COVID cases as many of the other age brackets above that. We track 9 different age groups from 0 to 90 plus years of age. And the majority of the cases kind of fall within a 6 bracket area from the age of 20 to 69. It was a little bit different of a bracket before, but from 20 to 69, it's pretty evenly distributed of about 25 to 30 cases per age group with a 10-year increment, so 20 to 30, 30 to 40, 40 to 50, and so on. Okay, and then testing is important. We know that's one of the stories on the whole COVID pandemic worldwide. We have increased our testing tremendously here with the help of our partners, to include the state with the National Guard testing recently. So today, the health department in our labs and through the National Guard has tested 36 persons. The hospitals, clinics, and physicians have submitted tests to commercial labs of 144 specimens. So a total tests performed in our area today is 180. When we add that to the numbers in our record that we've been tracking, we're just under 5,000 tests performed. And so you can see that number is dramatically increasing from what we had just a few days ago. So exactly, we're at 4,934. That number does not include, you'll see a bigger jump hopefully tomorrow. It does not include the 300 or so persons that were tested at STX Beef from the National Guard as of Monday. So they were testing there Sunday, Monday, and a little bit today from what I understand. So that number of 4,934 does not include STX's tests from yesterday. We'll probably see those tomorrow, so there'll be a bigger number tomorrow to report. Okay, there's our donut chart here. So this shows of the total 174 who has recovered and who is still active. And the majority, because of the large number of new cases from today, are in a active case. So 91 of the 171, when you take out the 3 deaths, are in an active situation or case. We have had 80 people recover though, and that's a 47% recovery rate. A couple of days ago it was in the 50s. That's because the caseload hadn't increased, but with a big increase in new cases over the past couple of days, the percentage of recovered has dropped, given that more persons now have it in an active situation. And then usually we report on the distribution of the cases in terms of where people live. They're not all within the city of Corpus Christi. There's several small and medium-sized municipalities in Nueces County, to include Robstown and Port Aransas. But today we're not going to talk about the distribution, since the data's not quite finalized with respect to the 27 new cases. We haven't had the opportunity yet with working with the health department and other agencies to determine exactly where those persons live. Some of them may actually live outside of Nueces County, so we don't want to put any misinformation out there, so we'll just not report on that today. But we should be pretty much up to speed by tomorrow, and we'll be able to give you the distribution by location. Okay, so that includes the update for today's statistics on the COVID-19 cases and recovery rates and so on. And at this point, we're going to translate into Spanish for the Spanish population through Gabby. And then Annette Rodriguez, our health director, will come up and talk to us about testing that's taking place locally.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 27 casos confirmados por el coronavirus. A la fecha son 174 casos confirmados. Tan solo el día de hoy se llevaron a cabo 180 pruebas. 99 son hombres y 75 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 4.934 pruebas por el virus entre el Distrito de Salud Pública y laboratorios privados. 80 de los 174 casos se han recuperado por completo. 8 personas continúan en el hospital, 4 en condición crítica en la unidad de cuidados intensivos. 91 casos continúan activos y a la fecha se reportan 3 fallecimientos.
Thank you. Annette Rodriguez, Health Director. The Health District did conduct a drive-through today in Bishop. Our next drive-through is this Thursday at 8 a.m. in the morning at the Old Memorial Hospital parking lot. To give the community an update on the halfway house and the meat processing plant. Today, we received 21 additional positive COVID-19 persons from Nueces County, that live in Nueces County from the meat processing plant. Most of the employees have been tested and the remaining will be tested today. The pending results should be back by the end of this week, no later than early next week. At the halfway house, we have a total of 19 positive cases, which includes 3 staff members. The Health District continues to contact trace every positive case to identify any additional persons that may have been exposed to any of the confirmed positive cases. The purpose of these contact tracing is to ensure everyone receives proper instructions on how to mitigate and lessen infections to healthy people. I would like to remind the community that this is a novel virus. It is a new virus and nobody has antibodies to this virus except for those of us that have actually contracted COVID-19. There is no vaccines available as of today. The best way to slow the spread and prevent transmission is to practice preventive techniques such as social distancing, at least 6 feet of social distancing between you and another person. Wearing a mask when you're out in an area where there's a lot of people. Avoid people who are sick. So again, the mayor says it very well. Sick people stay away from healthy individuals and healthy people stay away from sick people. Staying at home as much as possible and good hygiene habits such as washing your hands and not touching your eyes, nose, and mouth with unwashed hands. Also disinfecting frequently touched objects. These are the ways that you are going to help prevent the transmission of COVID-19 in our community. Stay safe, stay well, and as always, stay informed. Thank you.
En resumen, el Distrito de Salud realizó la toma de especímenes hoy en el poblado de Bishop, recolectando 36 muestras. La próxima toma será este jueves a las 8 de la mañana en el Hospital Memorial. El día de hoy recibimos los resultados de 21 personas adicionales al COVID-19 de la planta de procesamiento de carne South Texas Beef. La prueba se ha realizado a la mayoría de los empleados. Los restantes estarán listos para este fin de semana. En el centro de rehabilitación existe un total de 19 casos positivos que incluyen 3 miembros del personal. El Distrito de Salud continúa contactando cada caso positivo para identificar a cualquier persona adicional que pueda haber estado expuesta a cualquiera de los casos positivos confirmados. Con estas nuevas cifras de casos confirmados, queremos recordarle a la comunidad que este es un virus nuevo y que aún no se cuenta con una vacuna, por lo que es muy importante seguir todas las pautas de prevención de contagio, entre estas, distanciamiento social, utilización de cubrebocas y buena higiene.
Good afternoon, Barbara Canales, Nueces County Judge. This afternoon, I would like to concentrate on a draft release that a release that I have from STX Beef, and I'm going to start there, and then I have my own comments that I would like to make. To begin, the health and safety of our employees is the most important responsibility each day for us. We are proud of the continued diligence of our employees and the partnership of local, state, and federal partners, which has allowed STX Beef to rapidly test its team members. With over 600 employees tested to date, we will complete the testing of every employee today. Protocols that follow CDC guidance have been developed for employees infected with the virus. Those who test positive will be asked to self-isolate for 10 to 14 days, and they will not be allowed into the facility until they are cleared to do so by the appropriate agencies. While individual test results continue to be shared with employees as they become available. A full and accurate summary of test results will not be available until the tests are processed by third-party labs. We expect all tests to be processed by the end of the week. Now, I know this is not my release, but I'm going to repeat those two lines because I think they're very important as I read them, and it will help all of us understand the nature of the data that we expect. And I think it's really incumbent upon us to understand that when we get that data, we're really going to understand our situation. So let's repeat. While individual tests continue to be shared with employees as they become available, a full and accurate summary of test results will not be available until the tests are processed by the third-party lab. We expect all tests to be processed by the end of the week. Our focus is on ensuring the safety of our employees and continuing the critical work our employees do for the communities where we serve. I have no doubt that the STX family will continue to come together and help keep one another safe. Face masks and face shields, enhanced facility sanitation procedures, thermal camera imagery, and social distancing in the lunchroom and break areas will continue. We continue to evaluate additional information as it becomes available, and will make changes to our COVID-19 policies and procedures as needed. This statement was supplied to me by the executive staff of STX Beef, and I thought it was important that not only I receive it, but that you hear it, and that we could distribute it to the public. In addition, después de mis comentarios, lo tengo la misma en español, y si gustas Univision, Telemundo, podemos leerlo en ese momento. I simply said that I have the opportunity to have their remarks also in Spanish, and I would be happy to read them after I make my remarks and after question and answer period have concluded. So, after having the ability for the last few days to not only digest what's happening and what's transpiring, I believe that I have some comments that I hope will help those at home understand what's going on, what we're doing, and where we go from here. Let us begin. Well, here we are again, Nueces County, and when faced with a challenge, we rise to the occasion. We are a resilient and strong community. And part of that resilience comes from being prepared. Now, we know we track hurricanes and we can't stop them, but we can be prepared for their arrival. And this is really no different than today. And so it is with the emergence of COVID-19 outbreak in one of our meatpacking plants, STX Beef. We prepared for this day. And because we prepare in advance, our response has helped us work through this. Continued effort by our partners will help see us through. Now, Governor Abbott identified 3 areas of concern where conditions that can cause COVID-19 virus to spread. They were meatpacking plants, jails, and senior centers. We've seen 2 of those in the past week alone. STX Beef is a vital part of our community. They are a large employer, and they are a vital part of our nation's food supply. They are essential business, and one that was so important that the President has signed an executive order placing them under the Defense Production Act. And I'm proud of their commitment to making their plant safe as possible. In the time we have been testing our first responders and medical workers, we have learned that it's essential to remember that each employee has a home. Now, they may live alone with extended family, or they may have different circumstances on their environments. But we have made free testing available through the City County Health to all those living in the immediate household of STX Beef employees. Our first drive-through testing was held yesterday, Monday, May 11th, and we will have another one on Thursday, May 14th. At the conclusion of the comments, I'd like to focus a little bit on the number that you can call and a little bit more about that process during our Q&A. But, as I said, City County Health Department does have free testing available to all those living in the immediate household of STX Beef employees. This testing is voluntary, it's free of charge, and does not require a person to have any symptoms at all, just that they be living with an employee who has tested positive, or even an employee who has been in contact with an employee who has tested positive. You just need to be living in the same household with an employee of STX Beef, and this testing is available to you. Now, we will schedule additional testing for family members of STX employees if necessary. So I don't want anybody to worry that if they miss Thursday or they can't come on Thursday, that will be the last time. As the need is present, we will be there to answer the call. Now, there are employees who've tested positive, and there are those who have symptoms and those that have been hospitalized because of those symptoms. I know Nueces County and our healthcare regional partners are providing the best possible care for those who are ill, and we will continue to do so. Now, last week, when I thanked all who had worked to get a new rapid molecular diagnostic testing capability, you'll remember it was called the Gene, or I referred to it, it looked like Wally. This particular Cepheid rapid testing machine is an incredible capability at Krista Spawn's laboratory. And I stole a quote that Dr. Blow gave, citing Henry Ford. Dr. Blow said on that great occasion, "Coming together is a beginning, staying together is progress, and working together is success." Now, this teamwork, this success is needed more than ever now. And we are a Navy town. We're an Army town too, but we're a proud Navy town. And we are a port town. And we are a sailing and fishing town. And so all of us know the meaning of the phrase, all hands on deck. And this is an all hands on deck event for us. And so all hands includes our local partners, the city and the county, the health department, our first responders, our healthcare providers. All hands includes officials from the state of Texas and all our legislative delegation. All hands includes soldiers and airmen from the Texas National Guard who help provide additional drive-through testing capacity. And I want to thank them for their service. All hands includes the employees and management of STX Beef. We could not have accomplished this without both of them. We have the outstanding support of our regional health director at DSHS, that's the Department of State and Health Services, and the Assistant Chief of TETM and the Texas Division of Emergency Management. The President's executive order charged the Secretary of Agriculture and, in fact, the USDA with the responsibility for ensuring the safe operation of meat packing plants under the Defense Production Act, and that is supported by the Center for Disease Control and Prevention. It's also supported by the Department of Health and Human Services and OSHA, which is the Occupational Safety and Health Administration, and the Department of Labor. So you can see that there is a team effort going on to ensure our success. And I welcome their expertise, I welcome their resources, I welcome their commitment to ensuring the safety of our food supply and the safety of our workers and families first and foremost. Now, we all know, because we've been working together for over 50 days now, that this is a highly contagious virus and it spreads easily. And as we know, it can be spread even by people who are not showing any symptoms. So, do you remember when we came together? I do. It was March 16th. And I said something like, we knew this day was coming and we prepared for it. Well, we anticipated, because that's what we do in emergency management, that we might have this day come too. And now that it is here, we are doing everything, all of us, everything we can do in our power to confront this virus, this terrible invisible enemy. And like so many have said, we are in this, all of us, together. And as a team, I am confident that working together, we will ensure that we will care for all of those in our community that have been impacted by this pandemic. So, in summary, as you have already heard, the testing continues right now, today, and we will announce the total numbers of those tested along with the positive and negative results. We will be using this information to mitigate the spread of the infection and provide the earliest possible treatment for those who test positive. And of course, we will always pivot to whatever policies, whatever procedures, whatever it takes. That's what it means when you say all hands are on deck. And I am 100% confident that it is going to be critical that we understand the data drives the policy, and we need to wait for the data. Now, you have heard some numbers, and I want to give caution, and I want to issue a little bit of a caveat for all of those that are here today listening, watching at home. We need to understand the whole data set. What you have right now is just a piece of it. And what I'm committed to, what this county is committed to, what the city county health department is committed to, is to providing those results when we get them, whenever that is. It could be towards the end of the week, it could be earlier. But when we get it, mark my words, that we will come before you, whether it's a Tuesday or a Thursday, whether it's at 5 o'clock or at 1 o'clock, when we get a hold of the data, we are going to be calling in the press and we are going to be talking to the community. And when we present the information, it will be with an understanding of what it means. Right now, you have just such a small sampling. I'm not sure we have a full breadth of what it means. And so, I ask you for the hardest thing in the world, your patience. Nobody wants to know more than this entire team I've just talked about. You know why we want to know? Because we're ready to act immediately. And so I will come back before you as soon as possible to present that data set in its entirety so I can explain with the help, the expertise, the resources of the state of Texas, of our local and our regional medical health authorities, what that data means and what its impact is in our community. For now, please know that we are working round the clock to do everything we can to ensure the safety of the workers and their families. And I want to thank everybody involved who we have listed, because I will tell you that it does take all hands on deck to respond to this type of situation. Again, I would be happy to read the STX Beef after Q&A for Univision y Telemundo. Te agradezco.
En resumen, en cuanto a la planta procesadora de carne, se emitió un comunicado de prensa en el que, entre otras cosas, se indica que a los más de 600 empleados se les llevará a cabo la prueba. Quienes resulten positivos no podrán regresar a trabajar hasta que mejoren su salud. Al final del comunicado indica, mientras se realizan las pruebas por un laboratorio privado, continuamos haciendo lo posible por mantener la seguridad. Seguimos evaluando nuestras normas, entre otros comentarios. Somos una comunidad fuerte y es porque estamos preparados, y estábamos preparados en caso de que este brote en una planta procesadora de carne hubiera ocurrido. La planta procesadora es una planta vital para la nación y protegida por el gobierno. Hemos hecho la prueba disponible y gratuita para los empleados de la planta y continuaremos con las pruebas faltantes. Las pruebas gratis también se van a llevar a cabo y se les va a ofrecer a los familiares o aquellas personas quienes viven en la misma casa que los empleados de la planta, aunque no tengan síntomas. Continuamos trabajando para la utilización del equipo especial para analizar las pruebas junto con el Hospital Spawn. Quiero agradecerle a todos los empleados de las diferentes agencias que han estado trabajando en este reto sanitario, entre ellos del condado, la ciudad, la Guardia Nacional, los médicos y empleados de salud. Sabíamos que este día iba a llegar y ahora que está aquí estamos haciendo lo posible por combatir este virus y haremos lo posible por apoyar a nuestra comunidad. En cuanto tengamos el resultado de las últimas pruebas, las daremos a conocer, los casos positivos y los casos negativos. Las nuevas cifras nos darán las próximas pautas a seguir. Les pido que tengan paciencia y les explicaré una vez que tengamos todos los datos más recientes.
Thank you, Mayor Joe McComb, City of Corpus Christi. Just want to continue to say, I think, expand a little bit on the judge's comments on their South Texas Beef. A word of thanks to them for their proactive participation in identifying these folks. They started several weeks ago with a temperature testing project by a third-party contractor and a screening of people, and I think the results that we've seen so far, even though they sound lot 20 or whatever the number was, that could have been a lot higher had they not been proactive and caught the cases up front, and we want to thank them for that. And they'll continue to work with us on this partnership to address their needs. We want nothing more than to keep them in business and keep them healthy, and that's the objective of all of us, whether it be South Texas Beef or whoever it is in our community. The other thing, and we hear a lot of numbers, and a lot of people are concerned about numbers, and we're all concerned about numbers, and any number that increases the number of tests or the number of deaths is not a good sound to hear, but we need to really kind of keep in perspective what the relationship is with that number. And for instance, based on the number of tests, the number of cases that we have today, and Mr. Zanoni says the number of positive tests are 174, and out of that, 4,934 tests have been applied. And what that means is that that's about a 3.5% percentage point of a positive test to the number of tests administered. And that brings Nueces County to one of the lowest counties in the state of Texas in terms of their rating of tests administered to positive results. And so we're very proud of that, and we want to thank the public for their continued effort to do their social distancing, do what your mama and your grandmama taught you, wash your hands, keep your hands out of your mouth and rubbing your eyes, and if you're well, stay away from sick people, and if you're sick, stay away from well people. So we're continuing to make this fight. On the other front that we're battling with, and that is how we're going to pay for all of this, we continue to have communications on the state level. 14 Texas mayors wrote op-ed this weekend. It was in many newspapers around the state of Texas, encouraging the legislature to work with us and help us try to address some of the issues directly related with COVID, but not directly in terms of providing medical care, but directly in terms of loss of revenue for the cities and counties as a result of lost hotel motel tax, lost revenue from sales tax, lost revenue just for general, and the number of businesses that are having to cut back and loss of work and unemployment benefits being paid. So we're working with our state legislatures and our national legislators to address these things. We had a conference call, I believe it was Friday. The judge was on that call, and I was on the call, and finally the governor's office announced their plan of how they were going to distribute some of that CARES money that the federal government sent down to the states. And it was kind of interesting. The initial allocation was that counties and cities over 500,000 would have a direct allocation from the federal government, and those under 500,000 population would come through a block grant to the states, and then it would be administered by the state. Interestingly enough, out of the 254 counties in Texas, only 12 qualified for the 500,000 cutoff. So that meant the rest of us had to wait and see what we were going to be allocated, what was left out of that money that was sent down, and we got that shared to us Friday, and we'll begin to digest that and see what we can do. In the meantime, we're all tracking very vigorously to identify any and all costs associated with administering of the COVID virus and our response to it, because those funds are precious dollars that we're taking out of our budgets and our reserve funds now, and we will submit those expenses to the state and to the federal government for reimbursement. We appreciate that very much. We also had a big city mayors call. We have that each Friday afternoon, and the mayors are still communicating with each other about what they're doing in their communities and how we can best reopen the state of Texas, and we're doing it in the best ways that we can in the communities we have under the guidelines of what the governor's orders call for. And we just want to encourage people to continue to be patient, but be positive and continue to move forward. We're gonna win. We've started that victory lap. Don't know how long it's going to take us, but we are going to win, and it's because people will pay attention. There'll be a few out there that want to try to push the envelope, but we hope that they'll continue to practice their social distancing, taking care of their hygiene, and social gatherings, because really you're doing it not for yourself, but for the people you love and the people you work with and the people you appreciate. And so the more we work together for each other, the quicker all of us will rebound. So I would like to, I know there has been some questions, but I've gotten a call, and several people, but I'd like to read Just a statement from HEB, because some people are concerned about with the beef processing and what you're hearing nationwide and all this. But it says HEB sources most meat products locally from Texas and works with many suppliers across the nation. The testing at STX Beef is a proactive and necessary measure taken in partnership with the state and federal government to prevent a COVID outbreak and to protect the employees and the beef supply chain. HEB is in communication with all our suppliers, and we approve of the proactive measures taken to protect employees and process safe meat products at South Texas Beef. And just a word so they would know that the coronavirus, according to CDC regulations and guidelines, cannot be transmitted through the food process chain. So that's just to give you reassurance that everything is being done to make sure that you have a good, healthy food supply. HEB is appreciative of their suppliers, the proactive stance that they've done, and I think all of us know how active HEB is and how important they are to our community. So again, it's a team working together both on that end of the spectrum as well as our end of the spectrum. So thank you. And the media, we appreciate all the information that you provide to us and for us, and try to help the public as we move through this together. So Peter, I'll let you close out.
En resumen, quiero agradecer a la planta procesadora de carne por su participación y por ser proactivos. A pesar de la alta cifra, esta pudo haber sido mucho más alta si no hubieran actuado rápidamente. Basando en los números, de acuerdo al número de pruebas que se han llevado a cabo, casi 5,000, el número de positivos es de alrededor del 3.5%. Continuamos comunicándonos con oficiales y legisladores estatales para resolver temas vinculados con la pandemia, ya que hemos perdido ganancias como los del turismo y de los impuestos en cuanto a la industria hotelera. Por el momento estaremos reportando los gastos que hemos tenido esperando un reembolso por parte del Estado. Le pedimos que continúe siendo paciente. No sabemos por cuánto tiempo, pero lograremos el reto. Continúe con buena higiene, distanciamiento social, entre otras medidas. HEB también emitió un comunicado. Entre otras cosas, indica que las pruebas en la planta procesadora son proactivas, las cuales aplaudimos, ya que protegen a sus empleados. Y de acuerdo a los Centros de Control de Enfermedades, o CDC, el virus no es transmitido mediante las plantas procesadoras. Esperemos que con este informe la gente tenga mayor confianza.
Separately, I just wanted to make the announcement of the phone number that families can call if they have a STX Beef member in their family and they're living with that member. The number to call for testing is 414-6700. That number again is 414-6700. Remember, the testing is free. It will be held on Thursday. If you call the number, they will give you all the information that you need. You do not need to have a symptom. You just need to be living with somebody who either works at STX Beef or has had positive contact with somebody that works there as well. En español, si hay una oportunidad tener las pruebas haciéndolos gratis, hay un número para sacar toda la información que necesitas. Ese número es 414-6700. Otra vez, el número de teléfono para hablar si quieres tener información sobre las pruebas que son gratis para cualquier miembro de la familia, de gente que están empleados en la compañía, en la planta STX Beef. Ese número para hablar, para tener información sobre estas pruebas gratis, es 414-6700. Gracias.
Okay, that concludes our prepared remarks for today. So all the presenters, myself, Annette, the judge, and the mayor are here. If there's any questions from the media this afternoon.
From the judge. Yes, sir. I'm sure you've already had this out there. How many employees are in the plant that are going to be tested? And the other number is how many family members altogether? Do we know the numbers?
So I don't have the number of the family members right now. simply because contact tracing is going on right now. That's part of that statement that I said. I'm just going to ask, I know it's the hardest thing in the world is to want information and to not believe that you're getting it, but I think what would really be confusing is if I gave you a number that was based on speculation or guessing. Those contact tracers are so vital and valuable, and if you'll give us some time, we can bring back those numbers to you. I think that the second part of the question was how many employees total. I can only tell you that the statement that I read that was supplied to me by STX Beef, it said 600. So there could be more, but that was the number that was read by myself from their own statement. But I would like you to refer, we could refer to them, but I think that's probably a very close number. There are, always people I'm sure that are in transition, right? Whether they're temporary workers or full-time employees. So again, rather than get caught up in the details, I just want to refer back to the statement that I read.
Also today, on a different note, Governor Abbott made it mandated that all Texas nursing homes
Correct.
and employees be tested. Will that
Correct.
be done here?
It sure will, and we had a meeting about that just earlier this afternoon. Chief Rocha, from who really sits in two roles, not only as our fire chief, but he's also emergency manager for the city. And in that role, he has been summoned, as you said, by the governor. It's an incredible effort, and it's going to include not one, not two, but all of our nursing homes here in Nueces County. In addition, the chief has reached out to our emergency team, including myself, and said, tell us about the vulnerable populations that you know about. So if possible, we'll be extending that to any vulnerable population. So we'll see, we're going to develop that list. And I think that's a really comforting feeling to know that our state values life. Our state values the most vulnerable amongst us. And where there have been outbreaks in other states and even in other jurisdictions, outside Nueces, that has not happened to us here, but we want to be as proactive as possible. So how quickly that starts is, I believe he's assembling his teams, today.
One last question. How many nursing homes do you think there are out there in Nueces and the Atlanta?
So I was going to get clarification on that myself because I want to know, I'm pretty sure it's going to extend to assisted living centers. In other words, we say the word nursing home sort of, it's just that's a phrase we grew up with, right? But now we know that they're called assisted living centers. Some have higher levels of care than other. And so I'm going to ask Chief Rocha to provide that information. And by the next time I see you, I'm going to have that number and I'll break it down into those that are, the different categories of assisted living. Thank you.
I just had a question about the numbers that were added, cases that were added today at
Correct.
South Texas Beef. What does
Correct.
that bring the total to at the facility?
Well, and that's where I want to refrain from guessing, okay? I'm going to let the numbers speak for themselves right now, and I want to explain myself. Let me tell you what I have learned, is that when you're not sure of something, you should tell people, I am not sure. Why are we not sure? Because we need to do jurisdiction contact tracing. The numbers that have come in, we haven't been able to completely verify that they are all within the jurisdiction of Nueces County. In addition, the employer needs to verify that they are workers there currently, as opposed to did they work there previously, right? So there is different set of data. What I can tell you is that I know that there are positives today as we had positives over the past week. And to me, I'm going to be honest with you, one's too many for me, right? So what I want to say is that we are doing everything we can. I want to get all those tests in. We are using our lab here, which is as they say, the fastest in the South Texas, jurisdiction. South of San Antonio, this is the machine that you want, that Cepheid Gen X Infinity machine. And by tomorrow, we will have, I hope, more information to present to you as to when we can get that final number. What I want to bring to you is I want to say the following. We conducted X number of tests at this facility, and they're being conducted right now till 10 p.m. Out of the X number of tests that we conducted, X number were employees, right? X number could be an outside contractor or a vendor, and here are our positives and here are our negatives. And I think when you get that number, That's the number that you want. In addition, I'm going to hope that we can do some real fast contact tracing so that we can make certain that we can address the jurisdictional question, the zip code. We're so used to information because it's so easy when your numbers are low. But when you see this type of, uptick, the contact tracing becomes more challenging. Because you open the door, I'm going to share something with you that we did today. When I see this type of, uptick, I know I need to place a call to Director Rodriguez and say, do you have enough contact tracers? You'll recall that from a national level, what do we care about? We care about testing and we care about contact tracing because we know that both of those together, that 1-2, help suppress the spread of this virus. Right now, what I'm concentrating on is making certain our community has enough contact tracers. Because with the volume that we've seen over the past few days, we want to make sure that's being addressed. By coincidence, I got an email today from Texas A&M. Our governor has put forth a plan through our extension agents to help put a team together of Texas tracers. And we've asked for that team to come to our jurisdiction as soon as possible. In addition, I'm not just going to sit and wait. We're going to try to get as many people reemployed as possible. The health department is constantly looking for strong contact tracers, and we know we will need more of them. We are so happy with the ones that we have, but we want to make certain that we have the quickest turnaround time. How do we do that? We get more people in the room doing that type of job. So I think the numbers that are revealed, and I'm sorry they took it off, but we can bring it back for you. We have our stats. We're going to let those stats speak for themselves today as to the increased numbers. And rather than give you a wrong number, which I'm honestly very worried about doing because it's just too new, I would like to come back tomorrow and really give you the right data. And if you will allow me that, you will be part, as they say, of the solution, because giving misinformation causes confusion, and confusion leads to really the wrong conclusions. And I want to be really right on this. And I want us to concentrate on what's right. And what's right is we're going to test everybody. No matter if there's 600, 601, 621, 630, it doesn't matter. Everybody in there is going to get tested. And what I really want to emphasize, and please make sure that you put this up on your board, is anybody that needs a test because they're a family member living in a household unit, the City County Health Department has the resources, staff, and capability of getting everybody tested. Now, if we have lots of demand, we'll expand the dates. Right now, it's Thursday morning at 8 a.m. Again, the number to call so that you can get information, get your appointment, it's 414-6700. Thank you.
The Spanish.
Este resumen se trata de la planta STX Beef. Mis comentarios no son mis palabras, son las palabras de la compañía. Me mandan esto. La salud y seguridad de nuestros empleados es la responsabilidad más importante cada día. Estamos orgullosos del proceso diligente continuo de nuestros empleados y la sociedad que existe entre los miembros locales, estatales, federales que rápidamente han permitido la toma de pruebas. Con más de 600 empleados que se han hecho la prueba hasta ahora, terminaremos las tomas prueba de cada uno de los empleados hoy mismo. Los protocolos seguidos por el CDC se desarrollan para los empleados infectados con el virus. Los que resultaron con una prueba positiva se les pedirá que se mantengan aislados de 10 a 14 días y no se les permitirá la entrada al edificio de su empleo hasta que se aprueba por las autoridades apropiadas. Aunque los resultados se darán a conocer a los empleados cuando llegan a conocerse el número actual y preciso. Eso es, el número actual y preciso no se dará a conocer hasta que estos sean procesados por un laboratorio secundario. Esperamos que todas las pruebas se hayan procesado a fines de esta semana o más temprano. Nuestro enfoque es la aseguranza de la seguridad de nuestros empleados y la continuación del trabajo crítico que hacen para las comunidades que servimos. No tengo duda alguna que la familia STX continuará su alianza para proteger a uno a otro. Continuaremos con el uso de cubrebocas y máscaras, procedimientos higiénicos aumentados en el lugar de trabajo, una cámara térmica de imágenes y el distanciamiento social en el comedor y las áreas de descanso. Continuamos con la evaluación adicional de información cuando se nos presenta y haremos los cambios a nuestras pólizas y procedimientos de COVID-19 cuando sea necesario. Estas son las palabras de la compañía de la planta. De nada.
Okay, do we have any other questions for anybody else? Okay, great. Well, that concludes our presentation today. Tomorrow, we may have the county judge back tomorrow, possibly. But Annette and myself will be here for sure. Also tomorrow, I've invited Tom Schmidt from the aquarium, the Texas State Aquarium, to come and talk to the community. He, as well as many other entities, businesses, and so on, are opening up slowly but surely following the governor's orders. And Tom Schmidt has an excellent plan in place. In fact, we used it as an example for my departments here in the city to use and to look at, to develop our own plans on how do we open up safely. And so he is going to come to talk to the community about what precautionary measures he's put in place as he begins to reopen up the Texas State Aquarium. That's going to reopen Monday. And we're bringing him here as an example to show how a business, or in his case, a nonprofit, can reopen safely and allow employment to happen, allow people to make an earning or wages, but also allow persons to go to a destination to go to in the community. So Tom will be here tomorrow to educate the community on his reopening plan. There'll probably be some public buzz out there when he opens his doors on Monday. So we want the community to know what are his plans that he's going to put into place to make sure it's safe for not only his employees but for the community. And then you can see how he's modeling his reopening plans. I think it'd be a good example for the community to look at and listen to. So Tom Schmidt will be here tomorrow, myself, Annette, and Judge Canales potentially as well. So thank you for watching and stay safe. Bye-bye.